Hi everybody, I am Dr. Britt Talley Daniel and a neurologist and headache doctor, talking today on the subject of when to see a headache specialist. And I'll try to give you some tips on ideas that may be helpful for those of you who have enough headache problems that they really should check that out with a headache doctor. Now, I know a lot of you migraine patients out there are having headaches and you're taking medication for it, hopefully. What I read is 40% of you are treating over the counter, whereas triptans and drugs that work well for acute therapy would be better, but you have to see a doctor to get it. So I'm petitioning you to consider seeing a headache doctor to get on the right kind of medicine as well with this talk. Now you may be talking to your co-workers or your friends or your sister or your mother about this, and so hopefully I'll give you some ideas that will help you get through the tough decisions you need to make to get some help for treating headache. Now, one consideration is that headaches are 99% of the time are tension type headache or migraine headaches. And it's something like 30% of headache is migraine and 70% is tension type headache. Tension type headache is milder. It can only go on a scale of 1 to 10 to about level 5. It's described as being tighter pressure, but it doesn't have other symptoms with it like migraine does. And migraine may be one-sided. It can be severe. It can go to level 6, 7, 8, 9, 10. It may be associated with nausea or vomiting or sensitivity to light and sound. And they're also disabling and put you down. I think migraine is the number 5 most common cause of disability. Anyway, so most persons who go see a headache doctor, 89% of those people have what's called medication overuse headache, and most of them have migraine or else rarely tension type headache, and they're over-treating with headache medicine that gives them these frequent severe headaches. So what is a headache specialist? A headache specialist is somebody, usually it's a neurologist, and something like 60% of neurologists have migraine anyway. And these are doctors who are interested in headache. They like to read about it. They like to do research about it. They like to go to headache meetings. They enjoy seeing headache patients and trying to help them. Because if you can help someone with headache, it's really a great thing for a physician and hopefully for the patient. All right, so headache doctors specialize in this, and they may take a rotation in their residency training or even become specialized with an organization or have a fellowship. And when they see you, they're going to take a complete neurologic history, do a neurologic exam, and hopefully review any tests that may be already provided, maybe by your general doctor, such as a history, a blood work, maybe some imaging studies, such as a CAT scan or MRI scan, or spinal fluid exam occasionally. Or if that's not been done, then the headache physician generally will order those tests. So when should you see a headache physician, headache doctor? When headache is really bothering you and upsetting your life, when it's very severe and frequent and it's changing your life, so that you can't go take your daughter skating on her birthday on Saturday because you're home in bed disabled with a migraine and you don't have an adequate diagnosis or medical treatment for it. And headaches are really disturbing your life, your work, your social relationship. That's when you should see a headache doctor. All right, what are the concerning red flag symptoms that should be in your head that give you an idea you ought to go to the clinic or go to the ER and check out with a doctor? Well, generally, any complicated headache has unusual symptoms, something you never had before. If you feel weak on one side of your body or numb on one side of your body, or have trouble with vision and seeing, have trouble talking or reading, if you pass out and have a faint or something like a seizure, you should go see a headache doctor at that time to work that out. Persons that have complicated medical or psychiatric problems should consider seeing a doctor, such as asthma, fibromyalgia, chronic insomnia, epilepsy, people with depression. 50% of persons with depression have migraine, and 40% of persons who have generalized anxiety disorder, panic disorder, have migraine also. And the other thing about migraine is the International Classification of Headache has terms on the duration of how long a headache may be. So a migraine may be 4 to 72 hours. Well, any headache that's occurring that lasts 4, 5, 6 days is really too long for it to be a single episode of a migraine. It may be someone who's over-treating, like with caffeine or Tylenol or Advil or tramadol or something and giving them a headache. Any patient that's having headaches more than 2 days a week is a worrisome level. The headaches that make you miss social events or work or school. Headaches that affect relationships with family, friends, and co-workers. Any headache that occurs while someone's pregnant, if it's a new headache problem, or while nursing. There's a severe headache type, it's called in the neurology literature thunderclap headache. And these are headaches that are sudden in onset, just like thunder comes and it scares us all to death. It's very severe. It seems to right over our head and it's going to be lightning and kill us all. So thunderclap headache is a headache that goes 1 to 10 within seconds, sometimes knocks the patient to the ground. And anyone who has such a headache should check in the emergency room to see a doctor and have a CAT scan or even consideration of spinal fluid to rule out they're having a blood clot in their head or a ruptured aneurysm. And these headaches are described as the worst headache ever, or explosive, or like something blew up in my head, or the stories the doctor will hear. There's a category of headaches called positional headaches that come when change in intensity of headache from standing or lying down. That's concerning. Persons who have exertion-related headaches, like straining at the stool, exercise, sneezing, or coughing, those headaches should be worked up. Anyone who's over 50 years old and has never had headaches in their life but now has a new onset headache, that's a concerning problem, particularly if that person has medical complications of blood dyscrasia, like blood doesn't clot normally, or if they've had cancer previously. If someone with migraine has been keeping a diary, and that's a good thing and a good habit for migraine patients to do, to log their cycles and then the headaches and the treatments they're giving. If that's been noted that the headaches are now more severe, they were level 6 and now they're 10, or they were occurring once a month and now they're 4 times a week, those kind of things would be helpful, and the frequency of charting the headache will help you know you need to see someone. Any headache is always in the same spot. I've had patients who had headaches just right there at the one spot, and they should be evaluated and checked over and probably scanned just to be sure there's nothing there causing that. And then we get in this situation of the migraine with the aura patients. So something like 30% of headaches are migraine and 70% are tension headache. There could be migraine without aura and then migraine with aura symptoms. And the aura word there means warning symptoms that come with a headache. And there may be visual auras or warnings, which is seeing half of things, or seeing stars, or zigzag lines, or losing vision with blackness. There can be an aura of numbness and tingling that can develop and start in the fingers and then move into the hand, the arm, and go into the cheek and the tongue. Or there could be trouble talking or forming words logically, and that's called aphasia or dysphagia. So all of these aura symptoms, by definition, are supposed to last no longer than 60 minutes. And an aura that lasts longer than that is a complicated migraine that certainly should be checked out quickly. Anybody has a headache, it just never goes away. Headaches that come with symptoms, constitutional, systemic symptoms like fever, chills, weight loss, or night sweats. Any new headache occurs in somebody with cancer, go see the doctor. A headache that comes on and gets worse over 24 hours, you should check that out. And then headaches that may come with visual blackouts, with pain while chewing, body arthritis, or weight loss. Those are symptoms of what's called temporal arteritis. You gotta see a doctor, work that out. Okay, next I want to talk about the problem with the diagnosis of migraine. It's amazing, a lot of folks do not know that they have migraine headaches. And our culture has a series of pseudonyms or false names that people call migraine. I'll go over some of those with you now. So there's a thing called sinus headache, which was invented by the Sudafed industry in the 50s to sell Sudafed on TV ads that everybody's seen forever. The International Classification of Headache does not recognize sinus headache. And a Mayo Clinic headache doctor did a report. We had 100 patients with sinus headache. They thought, and when they saw the headache doctor, he thought 93 of them really were describing a migraine. So caffeine and Sudafed are two drugs that are available over the counter to treat mild drugs that treat migraine. With migraine, the arteries in the brain dilate, and drugs that cause constriction of the arteries can be helpful, like caffeine or Sudafed. So caffeine Sinutab or something like that is a weak drug for treating migraine. There's a thing called menstrual headache. The International Classification of Headache recognizes menstrual headache as a headache that occurs 2 days before bleeding, the day of bleeding, or 2 days afterwards. That's due to the fact that on the 3rd week of a woman's cycle, estrogen levels are high, and then the 3rd week they fall. And when estrogen falls, it gives women with migraine a headache. There's a thing called nocturnal headache. There is a differential diagnosis of nocturnal headache. I've taught medicine at 2 medical schools to residents and medical students, and you can pull them off to the side, and your doctor is supposed to give them tests and ask them things. I would say, give me the differential diagnosis of nocturnal headache, and they'd have to list a group of things what that would be. Well, 90% of nocturnal headaches is migraines. The other things would be a list called hypnic headaches, cluster headache, obstructive sleep apnea headache, temporal iritis, benign post-orgasmic headache, post-intercourse subarachnoid hemorrhage headache, and essential hypertension. Just high blood pressure folks will have nighttime headaches. Sick headache. Sick headache. Headache makes you nauseated or vomiting. Migraine turns on the vomit center in the brainstem and makes you sick and vomit. That's part of migraine. Some people will say, well, I don't really have migraine, I just got sick headache. Well, sorry, that's a feature of migraine. Hippocrates, 300 years before Christ, described a sick headache. One-sided headache. If you go to my website, Dr. Migraine, all one word, DoctorMigraine.com, and you load in, I have a picture of a woman there with pain behind one eye. And that's a feature of migraine. It's a one-sided headache. Well, Galen was a Roman physician in the 3rd century. He described a headache type that he named in the Roman Latin language hemicrania. Hemi means half, crania head. Like the hemispheres, or 2 spheres that make up a globe. Somehow or another, through time, the HE of that word was dropped off, and so you're left with the word micrania, which later didn't change. They added a G, and it became migraine. So our word migraine comes from Galen's half of head, and the number 1 feature of migraine diagnostically is that it may be one-sided. Hungry headaches. Again, people will say to me, well, I don't have migraine, it's hungry headache. Well, that's a feature of migraine. When your blood sugar gets low, your brainstem sends a signal out to generate dilatation of your arteries in your brain. It's just kind of a reflex. You get a headache. And one way to treat a hungry headache is to beat it and eat regularly. So how can I find a headache specialist? Well, you should start with your primary care doctor. That's probably the best person. He usually has a list of doctors he likes to refer patients to, and he'd be glad to give you a name. And he knows people who treat patients well that can help you. Also, the county or state medical society, the American Academy of Neurology, has a list of people like that. And the next thing I want to talk about is how do you prepare for your first visit with a headache specialist? Well, you should list and bring in a list of all the drugs you're taking, how much and what all you're taking. That should be listed and written down so the doctor can quickly look at that. Write down all the drugs also you take for a headache, and you got to include in there Sudafed and caffeine. Remembering that the American Headache Society says caffeine is the number one drug that aggravates migraine. You should comment on any family history of migraine, like my mother's got migraine, my daughter's got migraine, my sister got migraine, because migraine is genetic, and that'll help the doctor get into the flow of understanding that you may have the genetic kind of migraine thing. Bring in any of your imaging tests or medical testing and previous medical history you have from your doctor. I've seen in my time of practicing medicine over 40 years, seeing headache patients, many patients show up with no data, but they've asked their referring physician to send it in, and they get in my office and don't have anything. So try to get your records together. Go to online and look at some of the educational articles there. I would always refer patients to the Mayo Clinic, where I trained in neurology in the 70s, or to the American Headache Society. They're reliable groups. Or trust me, go to my website again. It's www.drmigraine.com. I have a whole bunch of articles on headache that can help you. And remember that all headache is a terrible, sometimes disabling condition. Most persons who have it can be treated adequately, and they don't have any serious medical problem, most of them. So God bless you, all you migraine persons, and I hope this has helped you, and I'll see you again next time. Bye.